All right, so today we are going to be looking at Cigna Group's Q4 2024 earnings call.
Yeah, definitely a lot to unpack here.
It's a bit of a head scratcher on the surface, right?
It is.
Record revenue,
Mm-hmm.
but a surprising earnings miss.
Yeah.
So let's kind of dive into what exactly happened and what it means for you listening to this.
Yeah, I think what is so intriguing here is they did pull in $247 billion in revenue for the full year,
Wow,
which is a 27% jump, which is incredible.
that's huge.
Yeah, but their adjusted EPS landed at $27.33, which actually missed expectations.
Okay, so it's like they hit a grand slam, but then tripped over first base.
Yeah, exactly.
What exactly tripped them up?
Well, one of the products that Cigna offers is stop-loss insurance. And basically what that is they sell it to employers to protect them from unexpectedly high medical claims from their employees.
Okay, so it's like a safety net.
Exactly. It's a safety net if healthcare costs go haywire. And, well, they kind of did go a little haywire.
Yeah. So it wasn't just a slight increase. It was like a tidal wave of expensive claims.
It was a tidal wave, and they were really concentrated in two areas: high-cost specialty medications and complex surgical procedures.
Okay, so like cutting-edge cancer therapies, intricate heart surgeries, things like that.
Exactly, yeah, like the kind of stuff that comes with these crazy price tags.
Yeah, I can see how that would totally mess up the calculations.
Yeah.
But if medical costs overall were up, why didn't it affect their other insurance products as well?
Well, that's the interesting part.
Okay.
Their fully insured employer plans actually performed pretty much as expected. So it really does seem like it was those super high cost claims that kind of just hammered that stop loss product, which again is designed to cover those outlier cases.
So like a levee built for a normal flood, but then a tsunami hits.
You got it. Perfect analogy. So it seems like they just didn't factor in this level of extreme claims when they were pricing their stop loss coverage. And that's what really torpedoed their earnings. And it raises the question, is this just a one-time anomaly, or is this the start of a new trend that we're going to be seeing in healthcare?
Right, and that's scary.
Yeah.
So they missed their earnings target, but they're not just, throwing in the towel, are they? How are they planning to right the ship?
No, they're not. They're actually taking some steps to course correct.
Okay.
The first thing is they're going to be adjusting their stop-loss pricing to reflect this new reality.
That makes sense.
Right. You got to adjust to the market.
Yeah.
They're also implementing some cost-saving measures and trying to make some operational efficiencies to kind of soften the blow.
Okay, so that's good. They're taking responsibility and not just, passing the buck to employers or anything.
Right. They're being proactive about it.
But even to these challenges, they're still projecting long-term growth, correct?
Yeah. They are, despite that earnings miss, they are sticking to their projection of 10 to 14% growth long term.
That's really impressive considering all the headwinds that they're facing right now.
Yeah, they seem pretty confident that they can navigate the storm, and they're not just, battening down the hatches either. They actually have some pretty exciting stuff happening over in their pharmacy benefit management business, Evernorth.
Yeah, so that's their shining star right now, right?
It is.
A lot of growth coming out of there.
And it's being driven by their specialty pharmacy services and their kind of leadership position in the world of biosimilars, which, we've been hearing a lot about biosimilars, and they're basically like the more affordable versions of those pricey biologic drugs that we were just talking about.
Right. Yeah, it's been a lot of buzz about biosimilars.
What is Cigna's strategy in this whole world?
Well, it seems like they're going all in on biosimilars. They're really embracing them.
Yeah. So, for example, they're offering a biosimilar alternative to Humira, which is that blockbuster drug for rheumatoid arthritis. And they're offering it at zero cost to patients.
Wow, zero cost. That's crazy, considering how expensive these specialty drugs can be. What's the catch?
There's no catch. It's actually part of their strategy to make these treatments more accessible.
Yeah.
And they're not stopping there. They've also announced plans to offer a biosimilar for Stelara, which is another high-cost specialty drug, also at zero cost to patients.
So it's like they're trying to disrupt the market and bring those prices down.
Yeah, they're definitely sending a message.
Wow. So they're projecting $100 billion, that's billion with a B, of U.S. specialty drug spending will face biosimilar competition over the next 5 years.
That's huge.
Yeah, that is huge. They're making big bets.
Yeah, they are.
Okay, so they're focused on making these drugs cheaper, but they're also trying to improve the overall patient experience, right?
Yeah, they're not just looking at the cost side. They're looking at the whole experience.
Especially when it comes to prescription drug coverage, which can be a nightmare.
Right. It can be a real headache.
So what are they doing to kind of make that easier for people?
Well, their pharmacy benefit manager, which is called Express Scripts, is making some big changes.
Okay.
First, they're committed to passing through more of those negotiated discounts to patients at the pharmacy counter, even during the deductible phase.
So that's huge for people who rely on those really expensive medications, right? Because those early year costs can be a real burden.
Absolutely, especially when you're hit with those high deductibles at the beginning of the year.
And then on top of that, they're going to provide patients with clear, personalized summaries of their annual prescription drug costs and the savings that they've received.
Right, transparency is key, especially in healthcare.
Yes, transparency is huge.
So they're tackling the affordability, the transparency.
They're also simplifying prior authorizations, right?
Yes, they're trying to streamline that whole process.
Is there anything else they're doing to make healthcare a little bit less of a headache?
Well, Cigna Healthcare is also expanding their support programs for patients with those complex conditions. Think about those folks who have chronic illnesses and need coordinated care from multiple specialists.
But yeah.
These programs can really make a difference in terms of their quality of life and just managing those costs over the long run.
It seems like they're really going beyond just being an insurance provider, but actually trying to become like a partner in their customers' health journey.
Yeah, that's the trend we're seeing across the industry, a shift toward a more holistic, patient-centric approach.
I like it.
But, all of these initiatives, they come at a cost.
Of course.
So the big question is, can Cigna afford to be so generous while they're also trying to improve their profitability?
That's the big question. That's what we're going to explore in part 2 of our deep dive.
Yeah, stay tuned.
We're going to find out if Cigna can really walk that tightrope between investing in the future and delivering value to their shareholders.
It's going to be interesting.
It is. Welcome back to our deep dive on Cigna's Q4 2024 earnings call.
Yeah, we dug into the numbers.
Yeah, we did.
And that little earnings surprise.
Yeah, now I'm kind of curious about their long-term vision, right?
Yes.
They're talking about making healthcare more affordable, more accessible, all that good stuff.
Yeah.
But how exactly do they plan on pulling that off?
Well, they're focusing on a few key areas. One is simplifying all that administrative stuff that drives everyone crazy.
Oh, the paperwork, the red tape.
Yeah, all of it.
Yeah, tell me about it. I've spent hours on hold trying to get a procedure pre-approved.
Exactly. It's frustrating, it's costly, and it's inefficient. So by simplifying things like prior authorizations,
Right.
Cigna is hoping to reduce those delays and get patients the care they need faster. And at the same time, it'll free up providers to actually focus on what they do best, which is treating patients.
Less time on hold, more time with the doctor. Sounds good to me.
Sounds good to me, too.
But streamlining paperwork is just one piece of the puzzle, right? What else is on their agenda?
So another big focus for Cigna is improving care coordination, especially for those patients with complex medical conditions. So you're thinking like people with chronic illnesses who often see multiple specialists and require ongoing management.
Right, because I've heard some scary stories about patients falling through the cracks because their care is not coordinated properly.
It's a real issue.
Yeah.
And Cigna is actually putting money where their mouth is and investing in programs and technologies to fix it.
Okay.
So they're working on creating a more seamless experience, trying to connect the dots between different providers and making sure patients aren't on their own navigating this really complex system.
It sounds like they're aiming for that holistic, patient-centered approach, recognizing that, health is influenced by a whole bunch of things.
Right.
Not just your physical condition.
Right. It's that whole person approach
Right.
that takes into account the social, emotional, and even financial aspects of health.
It's a big shift away from that traditional sick care model to something that's more preventative and proactive.
Yeah.
It's refreshing to see a big healthcare company actually embracing that.
Yeah.
But, transforming healthcare, that's a massive undertaking.
It is.
It requires collaboration, innovation, across the entire industry.
Absolutely. Cigna can't do this alone.
So what are they doing to kind of bring other players into the fold? What do those partnerships look like?
Well, they're working with some leading hospitals and health systems to develop innovative care models. They're investing in things like telehealth and virtual care technologies to expand access, especially in those rural and underserved areas. And they're even collaborating with pharmaceutical companies to develop these new value-based payment models.
So it's like a multi-pronged attack, hitting the problem from all sides.
Exactly. It's a big, ambitious plan.
What are some of the hurdles that they're going to have to overcome? Because transforming a system like healthcare, it's going to be a bumpy road.
Oh, absolutely. I mean, one of the biggest roadblocks is data interoperability.
Right.
All these different systems, they don't talk to each other.
Right. It's like a logistical nightmare.
It is. It's like trying to solve a puzzle with missing pieces.
So how is Cigna even approaching that? It seems impossible.
Well, they're actively involved in industry-wide efforts to come up with some common standards
That
and promote that interoperability.
makes sense.
They're also putting money into technologies that can actually bridge those gaps between systems so that data can be shared more seamlessly.
Okay, so they're playing the long game here,
Yeah,
trying to lay the groundwork for a system that's actually connected.
right. It's about taking those proactive steps
I like that.
to address these big fundamental issues.
Speaking of big moves,
Mm-hmm.
let's talk about the elephant in the room, which is Cigna's decision to sell their Medicare Advantage business.
Oh, yeah, that was a head scratcher.
It was
Caught a lot of people off guard.
to Healthcare Service Corporation, HCSC.
Yeah.
So what was the thinking behind that?
Well, it seems Cigna had been struggling in the Medicare Advantage space. There's just so much competition from these heavyweights like United Healthcare and Humana.
Right.
They just weren't seeing the growth they were hoping for.
So they cut their losses and decided to focus on their core strengths,
Basically.
which is their commercial health insurance business, and of course, Evernorth, which is booming.
Right.
But isn't Cigna kind of leaving a lot of money on the table by stepping back from that senior market?
It's a big gamble, for sure.
Yeah.
But they're betting that they can grow faster and more profitably by just focusing on what they're already good at.
It's a risky move, for sure.
It is.
But sometimes you got to prune the branches to let the tree grow stronger.
Exactly.
You have to wonder, though, are their competitors going to take advantage of this?
Oh, I'm sure they'll try.
Yeah.
I mean, the senior market is only getting bigger.
Right.
And now Cigna's basically ceding ground to their rivals. It'll be interesting to see what happens
It will.
over the next few years.
Let's go back to Evernorth for a second.
Okay.
And their push into the world of biosimilars. We talked about this earlier, but I want to dive a little deeper.
Sure.
What's the potential impact of this whole biosimilar trend on the pharmaceutical industry as a whole?
It's a big one. Biosimilars are basically the generic version of biologic drugs,
Right.
which are these really complex therapies derived from living organisms.
Yeah.
They've revolutionized treatment for a lot of diseases, but they're really expensive.
Yeah.
Biosimilars offer a more affordable alternative without compromising safety or effectiveness.
So it's like the generic drug revolution, but for these biologic drugs,
Exactly.
which is huge for patients who are struggling to afford those medications.
Absolutely. And it has the potential to lower healthcare costs across the board.
Yeah, because these biologics are taking up a bigger and bigger piece of the pie when it comes to drug spending.
Right. So even a small price decrease can make a huge difference.
Everyone wins except maybe Big Pharma.
Yeah. I don't think they're too happy about this.
They've enjoyed all that exclusivity, all those profits,
Right. For years.
and now they're facing competition.
It's a classic disruptive innovation story.
And Cigna is right on the front lines of that disruption. They're promoting biosimilars, making them more accessible to their customers.
Yeah, they're all in.
But are there any challenges? It seems like a pretty bold move to go up against those giants.
I think one of the biggest challenges is overcoming the skepticism and misinformation that's out there.
Right.
There's still a lot of confusion about biosimilars, even among healthcare providers.
Right.
Some people worry that they're not as safe or as effective as the original brand name drugs,
Right.
which isn't true.
So it's like a public education campaign is needed.
Exactly. And Cigna's investing in that, trying to educate providers and patients about biosimilars, dispel those myths, and build trust.
Good.
It's not just about saving money, it's about making sure patients have access to the best treatments, no matter their financial situation.
Right. It's a worthy cause for sure.
It is.
But like with any disruptive innovation, it takes time for the market to catch up. It's going to be interesting to see how quickly biosimilars are really embraced.
Yeah, it's a fascinating dynamic to watch.
It speaks to Cigna's willingness to embrace change and kind of push those boundaries.
They're not just reacting to market forces, they're trying to shape the future.
Well said. We've covered a lot in this part of our deep dive, from administrative simplification to care coordination to the Medicare Advantage divestiture and the rise of biosimilars. Cigna is definitely a company in transition.
Yeah, they're navigating a really complex and ever-changing landscape.
They're facing some headwinds,
For sure.
but their long-term vision seems pretty clear. They want to become a more patient-centric, data-driven, and value-oriented healthcare company.
Yeah, it's an ambitious vision.
It is.
Only time will tell if they can achieve it, but it's definitely going to be fascinating to watch.
Now, for the final part of our deep dive, we're going to get into the nitty-gritty of Cigna's financial performance, their capital allocation strategy, and what it all means for investors, so get ready to crunch some numbers.
Time to dig into those financials.
All right, so we've made it to the final part of our Cigna deep dive.
The grand finale.
We've talked big picture, strategic moves, even a little bit of disruption in the industry. Now it's time to, really get down to brass tacks.
Yeah, let's look at those financials.
Look at the financials, see if the engine can deliver on all those promises we've been talking about.
Exactly.
So, big number, $247 billion in revenue for 2024.
That's a big number.
27% increase.
Yeah.
It sounds really healthy, right?
It does.
But we also got to remember that earnings miss.
Right.
So $27.33 adjusted earnings per share, a little bit lower than what people were hoping for.
It was.
So how are they approaching 2025? Are they forecasting a rebound?
They are. So for 2025, they're projecting at least $252 billion in revenue, consolidated adjusted revenue.
Okay.
So continued growth there. And they're aiming for at least $29.50 per share.
Okay, so a slight bump up from 2024, but not a massive leap forward.
Yeah.
Are they being conservative? Or are there some factors holding them back, you think?
Well, remember all those patient and provider-centric initiatives we talked about?
I do, yeah.
Those are going to cost some money.
Right.
They actually earmarked up to $150 million for those programs. So those investments, they're going to impact their bottom line in the near term.
Yeah, it's like a classic trade-off. Invest now for those future gains, but you might see a smaller bump in the short term.
Exactly. It's all about balance.
Right.
Cigna's betting that these investments are going to pay off down the road by attracting and retaining customers, improving health outcomes, and ultimately boosting their profitability.
Right.
But, it does create a little bit of uncertainty in the short term.
Speaking of uncertainty, how are they managing their cash flow and, their capital allocation in this environment?
Well, even with that little earnings hiccup, they're actually in a very strong capital position.
Right.
So they generated over $10 billion in cash flow from operations in 2024,
Right.
which shows you their core business is strong.
Right.
And they actually increased their share repurchase authorization to $10.3 billion.
Wow. That's a lot of money.
It is.
Buybacks are usually a good sign for investors, right?
Right.
It means the company thinks their stock is a good deal.
It can be, yeah, definitely a signal of confidence. Suggests they see more value in investing in themselves than in looking for external opportunities right now.
So they're making money, buying back shares, and putting money into these new initiatives.
Yeah.
Sounds like they're firing on all cylinders, even with the earnings miss.
Yeah, it shows you they're thinking long term,
Right.
not just chasing those short-term profits, but trying to build a strong foundation.
It's like renovating a house while you're still living in it.
Exactly.
There's going to be some mess.
Yeah, some disruption.
But ultimately, you end up with a better, more valuable property.
Right, exactly.
But renovations can be stressful
They can.
and expensive.
Yeah.
Are investors, are they on board with this vision? Or are they getting a little bit nervous?
Well, that's the big question, isn't it? As always, investors need to do their homework, make their own decisions.
Right. This is not financial advice.
Not at all.
We're just trying to understand what's going on here.
Exactly.
But there are some things to keep in mind, right?
Yeah.
Cigna is a big, established company,
Very well established.
diversified portfolio of businesses.
Right.
They've been around the block a few times. They've weathered storms before.
They had to.
They know how to adapt.
They're not a flash in the pan.
Exactly.
They've got the experience, the scale, and they understand this market.
They're also investing a lot in innovation, right?
Yeah, definitely positioning themselves to be leaders in those key growth areas like biosimilars and value-based care.
Yeah, those are the hot topics in healthcare right now.
They are.
But we also got to acknowledge the challenges, right?
Of course.
That stop-loss issue, that showed us some vulnerabilities.
It did.
And the healthcare market, it's just getting more and more competitive.
It's a tough business.
It is.
Margins are tight, regulations are complex, and the stakes are high.
Yeah, no doubt about it.
So I think overall, Cigna's story is one of resilience, adaptation, and a real commitment to shaping the future of healthcare. Whether that translates into a winning investment, that's for each individual to decide.
Right.
But their story is definitely one worth following.
Absolutely. All right, before we wrap up, we always like to have a little fun with our This Is Not Financial Advice segment.
Let's do it.
Got any outrageous but plausible trade ideas inspired by this Cigna earnings call?
All right, here's one. Short, big pharma, go long telehealth providers.
Ooh, I like it. Tell me more.
So Cigna's success with those biosimilars, their focus on telehealth, it signals a bigger change happening in healthcare.
Okay.
Those traditional pharmaceutical companies with their high-priced drugs, they might start feeling the pressure as these more affordable alternatives become popular.
Makes sense.
Then telehealth is booming, offering convenience, accessibility,
Right.
things that the traditional models just can't match.
So it's like betting on a future where healthcare is less about pills and procedures, more about preventative care, remote monitoring, virtual consultations.
Exactly. It's a bold bet, but, Cigna's moves suggest this future might not be too far off.
All right, folks, this is purely hypothetical. And again, this is not financial advice.
Not at all.
Don't go making any investment decisions based on our little thought experiment here.
Right.
Do your own research, talk to a financial advisor, and always remember, investing involves risk.
Always good to remember.
All right, so there you have it, folks. We've reached the bottom of our Cigna deep dive.
We made it.
We explored their financials, their big decisions, and their vision for the future of healthcare.
It's been quite a journey.
It has.
I hope it's been informative for everyone listening, whether you're an investor, a healthcare professional, or just someone who's curious about this ever-changing industry.
And that's a wrap for today's deep dive. Thanks for joining us.
It's been a pleasure.
Until next time, keep diving.